Your legs are not getting weaker after 60 because you are lazy. Your legs may be getting weaker because the muscles that control balance, walking, stairs, and fall prevention are not being trained the right way. I'm Dr. Nathan Fox, and today I want to explain why seniors should do these 5 exercises to build leg strength fast after 60, better than squats. Many seniors think squats are the best exercise for weak legs. But after 60, and especially after 70, deep squats may feel painful on the knees, stressful on the hips, and unsafe for balance. The problem is not that seniors should stop moving. The problem is that seniors need the right exercises for the body they have now. Because leg strength after 60 is not only about muscles. Leg strength after 60 is about getting out of a chair without pushing with your hands. It is about climbing stairs without fear. It is about walking without shuffling. It is about turning safely in the kitchen. It is about stopping a fall before it happens. In this video, I'll show you 5 exercises for seniors that may help build leg strength, improve balance, support mobility, and reduce fall risk, without painful squats or dangerous high-impact workouts. You'll learn simple movements like the stair hover hold, toe lift walk, seated resistance push, side step reach, and the #1 movement that trains balance and leg strength together. But stay with me, because exercise #1 may look too simple at first, but it may train the hidden stabilizer muscles many seniors stop using after 60. These exercises are not about looking younger. They are about walking with confidence, standing with control, protecting your independence, and keeping your life from becoming smaller because your legs no longer feel strong. Before you try any new exercise, especially if you have knee pain, hip pain, dizziness, heart problems, recent surgery, or a history of falls, talk to your doctor or physical therapist first. But if you are over 60 and your legs feel weaker, this may be the routine your body has been waiting for. Before we begin, write your age in the comments. Also, write legs if you have noticed your legs getting weaker after 60, or if stairs, walking, balance, or standing from a chair no longer feel as easy as before. Many seniors are told that weak legs are just normal aging, but that is only partly true. Aging can reduce muscle strength, balance, reaction time, and confidence, but weakness is not something you must simply accept without action. The body can still respond after 60. The muscles can still learn. The nerves can still send stronger signals. Balance can still improve. Walking can become steadier. Standing from a chair can become easier. But the exercise must match the real problem. Squats may help some people, but squats are not always the safest starting point for seniors with knee pain, hip stiffness, poor balance, back pain, or fear of falling. A deep squat asks the knees, hips, ankles, spine, and balance system to work together under body weight. If one part is weak, the whole movement can become stressful. So instead of forcing your body into painful squats, I want you to think differently. After 60, the goal is not to punish your legs. The goal is to wake them up. The goal is to train the muscles that help you live. A strong leg is not just a leg that can push weight. A strong leg is a leg that can stop you from falling. A strong leg is a leg that can lift your foot over a rug. A strong leg is a leg that can hold you on one step. A strong leg is a leg that can move sideways when you lose balance. A strong leg is a leg that helps you stand up without fear. That is the kind of leg strength after 60 we are building today. Exercise #5 is the stair hover hold. This exercise trains control for stairs, chair rising, and standing balance. Many seniors do not realize they are losing stair strength until they pause at the bottom of the staircase. One foot goes up, the body hesitates, the hand reaches for the rail, and the mind says, "Be careful." That hesitation is not just fear. It can be a sign that your legs are no longer confident transferring weight from one side to the other. The stair hover hold trains that exact moment. Here is how to do it. Stand at the bottom of a staircase. Use the handrail. If you do not have stairs, use a very low, sturdy platform that does not slide. Put one foot on the bottom step. Keep the other foot on the floor. Now begin to lift your body slightly, as if you are about to step up, but stop halfway. Do not fully climb. Hold that halfway position for 3 to 5 seconds, then slowly lower back down. That slow lowering is important. Do not drop, do not collapse. Lower with control. Do this 3 times on one side, then switch legs. If 5 seconds is too much, hold for 2 seconds. If the movement hurts your knee, reduce the height, hold the railing, or skip it until a physical therapist guides you. Why does this exercise work? Because it trains the thigh, hip, ankle, and balance system at the same time. It teaches your leg to hold your body weight, not just move quickly. Many falls happen when the body cannot control a transition. The stair hover hold trains transition control. A man I'll call Thomas was 73. He could walk on flat ground, but stairs made him nervous. He thought he needed stronger thighs, so he tried squats, and his knees hurt. Then he started with stair hover holds using a rail. At first, he could hold only 2 seconds. After several weeks, he held 8 seconds and walked upstairs with more confidence. This is what I mean by better than squats. Not because squats are evil, because the stair hover hold trains the exact life movement many seniors struggle with. Exercise number 4 is the toe lift walk. This exercise trains the front of the lower leg, especially the muscles that lift your toes when you walk. Many seniors focus on knees and thighs, but they forget the feet and ankles. Then the walking pattern changes. Steps become shorter. The feet slide instead of lifting. The toes catch on rugs, cracks, thresholds, or uneven pavement. This is called shuffling. Shuffling is not just a walking style. It can be a warning sign that the foot is not clearing the ground well. The toe lift walk trains that missing lift. Here is how to do it. Stand near a wall, counter, or hallway railing. Keep one hand close for safety. Walk slowly for 10 to 20 steps. With each step, lift your toes upward before your foot lands. Do not stomp. Do not rush. Do not lift your knee high. Focus on the toes pulling up. You should feel the front of your lower legs working. If you feel unsteady, do this in place. Stand tall, hold a counter, and lift the toes of both feet up while keeping your heels on the floor. Lower slowly. Repeat 8 to 10 times. The toe lift walk may look simple, but it trains a very important pattern. It tells your brain and lower leg muscles, pick up the foot, clear the ground, do not drag. A woman I'll call Elaine was 76. She had not fallen, but she had tripped several times on rugs. She said, "My feet just do not lift like they used to." She started practicing toe lift walks in her hallway. She held the wall, moved slowly, and focused on lifting her toes. Over time, her steps became cleaner. Again, this is leg strength after 60, not just big muscles, useful muscles. The toe lift walk may help walking confidence because it trains the muscles that protect each step. Exercise number 3 is the seated resistance push. This exercise is powerful because it can be done from a chair. Many seniors who cannot safely squat can still use this movement to wake up the thighs, hips, and nervous system. Sometimes weak legs after 60 are not only about muscle size. Sometimes the brain-to-muscle signal becomes weaker. The muscle is there, but the body does not recruit it strongly. The seated resistance push teaches the legs to turn on again. Here is how to do it. Sit upright in a sturdy chair. Keep both feet flat on the floor under your knees. Keep your back tall. Now press both feet down into the floor as if you are trying to stand up, but do not actually stand. Push hard enough to feel your thighs and hips tighten. Hold for 5 seconds. Then relax completely. Repeat 6 to 8 times. Do not hold your breath. Breathe normally. If you have uncontrolled blood pressure, chest pain, severe shortness of breath, or dizziness, stop and ask your doctor before continuing. This exercise is safe for many seniors because it does not require deep knee bending, jumping, or heavy weight. But simple does not mean useless. When you press your feet into the floor, your thighs, hips, and glutes activate. Your nervous system sends a signal down the legs. Your body practices the beginning of standing up, without the full demand of standing. A man I'll call Harold was 80. He struggled to get out of low chairs. He always pushed with both hands. He started seated resistance pushes every morning before breakfast. After 2 weeks, he noticed he could feel his thighs working again. After a month, he could stand from a higher chair with less hand support. That is a major victory after 60. Because standing from a chair is independence. If you cannot stand from a chair, your life becomes smaller. You avoid low seats. You avoid restaurants. You avoid visiting friends. You worry about bathrooms. You worry about being stuck. The seated resistance push trains the first part of that life skill. Exercise number 2 is the side step reach. This exercise trains sideways stability. And sideways stability is one of the most ignored parts of senior fitness. Most people walk forward. Most exercise videos move forward and backward. But many dangerous falls happen sideways. You turn in the kitchen. You reach for a shelf. You step around a chair. You catch your foot on a rug. Your body shifts sideways, and the hip muscles must respond quickly. If those muscles are weak, the body may not catch itself. That is why seniors should do these 5 exercises to build leg strength fast after 60. Better than squats. Squats mostly train up and down. Life also moves side to side. Here is how to do the side step reach. Stand beside a sturdy chair or counter. Keep one hand lightly on it for support. Take one slow step to the side. As you step, reach the opposite arm gently to the side at shoulder height. Pause for 1 or 2 seconds, then return to the center slowly. Repeat 5 times to one side, then 5 times to the other side. Move slowly. Keep the step small. Do not lean too far. Do not twist quickly. If you feel dizzy, stop. If your balance is poor, keep both hands near support or ask a physical therapist to guide you. Why does this work? Because it trains the outer hip, the standing leg, the ankle, and the core to respond when your center of gravity shifts. That is exactly what happens before many falls. The body moves off center, and the legs must bring it back. A woman I'll call Ruth was 74. She felt okay walking straight, but she felt unsteady turning in the kitchen. She noticed that reaching into cabinets made her sway. She started practicing side step reach while holding the counter. At first, she kept the reach small. Over time, she became steadier. The side step reach does not look dramatic, but fall prevention after 60 is not always dramatic. It is often about training the small moment before the fall happens. The moment your body leans, the moment your foot must move, the moment your hip must catch you, the moment your brain must say, "Recover now." That is what this exercise trains. Now we reach exercise number 1. The number 1 movement is the single leg clock tap. This is the exercise that brings everything together: leg strength, balance, ankle control, hip stability, coordination, and confidence. At first, it may look too easy. You stand on one leg and tap the other foot forward, sideways, and backward like points on a clock. But do not underestimate it. Falls do not happen in perfect gym movements. Falls happen when the body must react. The single leg clock tap trains reaction, control, and trust. Here is how to do it. Stand behind a sturdy chair. Hold the back of the chair with both hands. Shift your weight onto your left leg. Keep your left knee soft, not locked. Now imagine a clock on the floor around you. Tap your right foot forward to 12 o'clock. Bring it back to the center. Tap your right foot to the side like 3 o'clock. Bring it back to the center. Tap your right foot slightly behind you like 6 o'clock. Bring it back to the center. That is 1 round. Do 3 rounds on one leg, then switch sides. Move slowly. The standing leg is the working leg. The tapping foot is only lightly touching the floor. You are not kicking. You are not rushing. You are teaching the standing leg to control your body while the other foot moves. If this feels too hard, make the taps very small. If you feel unsafe, keep both hands on the chair. If you have severe balance problems, Do this only with supervision. As you improve, you can reduce hand support. First, use both hands. Later, use one hand. Later, use fingertips. But safety comes first. The single leg clock tap is powerful because it trains real-life balance. When you walk, turn, step around furniture, or recover from a stumble, one leg often has to support your body while the other leg moves. That is exactly what this movement practices. A man I'll call George was 77. He had weak legs after 60, but his bigger problem was trust. He did not trust his body. He walked stiffly. He avoided uneven ground. He always looked for something to hold. When he started the single-leg clock tap, he could barely tap forward without gripping the chair. But he practiced every day. After several weeks, he moved with less fear. That is what strong legs really give you. Not just muscle, trust. Now let's put the 5 exercises together into a simple routine. Do not do too much on day 1. Start with 1 round. First, the stair hover hold. 3 repetitions on each leg. Second, the toe lift walk. 10 to 20 steps or toe lifts in place. Third, the seated resistance push. 6 repetitions. Fourth, the side step reach. 5 repetitions each side. Fifth, the single leg clock tap. 3 rounds each side. This may take less than 10 minutes. Do this 3 times per week at first. If your body responds well, you can do some gentle version most days, but leave room for recovery. Seniors need consistency, not punishment. The CDC says adults 65 and older should do at least 2 days of muscle strengthening activities each week and include activities to improve balance. This is why leg strength after 60 is not optional. It is protection. It is fall prevention. It is mobility. It is independence. But remember, exercise must be safe. If you have chest pain, severe shortness of breath, dizziness, fainting, sudden weakness, new swelling, recent surgery, severe knee or hip pain, or a recent fall, get medical advice before starting. Now let's talk about the biggest mistake seniors make with exercise. They rush. They try to prove they can still do what they did 20 years ago. They push through pain. They copy younger people. They do deep squats, fast lunges, heavy weights, or floor exercises they cannot safely get out of. That is not wisdom. After 60, better exercise is not always harder exercise. Better exercise is more specific. The stair hover hold is specific to stairs. The toe lift walk is specific to walking without shuffling. The seated resistance push is specific to standing from a chair. The side step reach is specific to sideways balance. The single leg clock tap is specific to fall prevention and coordination. This is why these 5 exercises to build leg strength fast after 60, better than squats, may help many seniors. They train the body for life. Now let's talk about pain. Exercise should create effort. It may create mild muscle fatigue. It may create a warm feeling in the thighs or hips, but it should not create sharp pain, chest pain, severe joint pain, dizziness, or a feeling that you might fall. If pain appears, stop. Make the movement smaller. Use more support. Reduce repetitions. Ask a physical therapist. Do not ignore pain because a video told you to exercise. Your body is not a machine. Your body is a partner. Listen to it. Now let's talk about progress. In week 1, your goal is not strength. Your goal is learning the movement safely. In week 2, your goal is control. Move slower. Hold support. Feel the muscles working. In week 3, your goal is confidence. Add 1 repetition if safe. In week 4, your goal is real-life improvement. Notice whether standing feels easier. Notice whether stairs feel less frightening. Notice whether your feet lift more cleanly. Notice whether turning feels more stable. Progress after 60 is not always loud. Sometimes progress is walking to the mailbox with less fear. Sometimes progress is standing from the chair without rocking 3 times. Sometimes progress is climbing 1 step with more control. Sometimes progress is not falling. That matters. A woman I'll call Maria was 82. She told me, Doctor, I do not want to be an athlete. I just want to walk to my garden. That is the heart of senior fitness. It is not about medals. It is about gardens, kitchens, grandchildren, churches, grocery stores, front doors, and living rooms. Strong legs protect those places. Weak legs slowly take them away. Now let's repeat the 5 exercises. Exercise number 5. Stair hover hold. It trains stair control and weight transfer. Exercise number 4. Toe lift walk. It trains the front of the lower leg and helps reduce shuffling. Exercise number 3. Seated resistance push. It wakes up the thighs and hips from a chair. Exercise number 2. Side step reach. It trains sideways stability and fall prevention. Exercise number 1. Single leg clock tap. It trains leg strength, balance, coordination, and trust. If you can do only one today, choose the safest one. If stairs scare you, start with seated resistance push. If you shuffle, start with toe lift walk. If sideways balance scares you, start with side step reach using support. If you want full balance training, start with single leg clock tap while holding a chair. The best exercise is the one you can do safely and consistently. Now here is your 7-day Dr. Nathan Fox leg strength plan. Day 1. Learn the seated resistance push and toe lift walk. Day 2. Repeat them and add side step reach. Day 3. Rest or take a gentle walk. Day 4. Add stair hover hold if safe. Day 5. Practice single leg clock tap with both hands on a chair. Day 6. Repeat the full routine gently. Day 7. Review your progress. Which movement felt hardest? That is probably the one your body needs most, but do it safely. Do not chase speed, chase control. Do not chase pain, chase confidence. Do not chase perfection, chase consistency. Now I want you to picture your life 6 weeks from now. You stand from the chair with more control. You walk across the kitchen with less fear. Your toes clear the floor better. You step sideways without grabbing the counter in panic. You climb the first stair with more trust. You still respect your limits, but you no longer feel trapped by them. That is what the right exercises can give back. Not overnight, not magically, but step by step. The National Institute on Aging says physical activity is an important part of healthy aging, and balance exercises can help prevent falls. So do not wait until a fall forces you to take leg strength seriously. Start now, gently. Start today, safely. Start before your world gets smaller. Write "strong legs" in the comments if you want a simple weekly leg strength after 60 routine. Also tell me which exercise you want to try first. Stair hover hold, toe lift walk, seated resistance push, side step reach, or single leg clock tap. If you are over 50 or 60 and care about leg strength, senior exercises, fall prevention, balance exercises, mobility, walking confidence, knee-friendly exercise, and healthy aging, subscribe to Dr. Nathan Fox. On this channel, I explain simple senior health steps that help you protect strength, confidence, and independence. This video is educational only. It is not medical advice, diagnosis, treatment, or a personal exercise prescription. Talk to your doctor, physical therapist, or qualified healthcare provider before starting a new exercise routine, especially if you have heart disease, dizziness, severe arthritis, osteoporosis, neuropathy, recent surgery, uncontrolled blood pressure, recent falls, or pain that changes how you walk. Do not do any exercise that feels unsafe. Do not ignore chest pain, fainting, severe shortness of breath, sudden weakness, or severe joint pain. Do not force deep squats if they hurt. Your legs are not getting weaker after 60 because you are lazy. Your legs may simply need the right signal again. The right movement, the right support, the right routine, the right patience. These 5 exercises to build leg strength fast after 60, better than squats, may help you begin that process safely. Start small. Hold the chair, move slowly, breathe. And remember what strong legs are really for. They are for your stairs, your kitchen, your garden, your grandchildren, your morning walk, your front door, your independence. I'm Dr. Nathan Fox. Take care of your legs, protect your balance, protect your freedom, and I'll see you in the next video.